Dementia Researcher with a blog and a rating.
Learning about dementia care in India and why international research visits remain important. July has been pretty busy in terms of travelling, but very worthwhile. Having presented our recently published systematic review on inequalities in dementia social care across 23 countries, and emerging findings from our ESRC Columbia Mental Health Study at the IPA Congress in Portugal, the very next day I flew out to Bangalore in India to set up a new dementia collaboration between the University of Liverpool and the NIMHANS and the Institute of Public Health. Always wanting to go to India, but actually now travelling there for work was very special and so much more insightful than any article you can read about dementia care in this vast country. The NIMHANS, or National Institute for Mental Health and Neurosciences, appears to be the leading centre on dementia diagnosis and care in the country. I've read a lot about their work prior to visiting, so it was a pleasure to put what I've read into context. After a long tuk-tuk drive across nearly all of the NIMHANS hospital grounds, including mistakenly entering the gated psychiatric wing, only to realise we should head to the neurology unit, we met a number of clinicians and clinical academics from Bangalore. We exchanged stories about dementia, me asking lots of questions about how diagnosis and care is delivered, in the city but also in the country, and learned that patients come from all over India to receive a diagnosis here. This is, if they know about dementia, if it's not too stigmatized within their family, and crucially, if they have the means to pay for it themselves. Giving a talk in front of over 100 clinicians, students and academics about my research in inequalities in dementia opened up an important discussion about the topic, more so than you possibly can do via Zoom or Teams in a webinar, when you've never met people before. Prior to the seminar, we've been walking over the private hospital garden grounds where staff and the few inpatients there enjoyed some calm outdoor time, away from the bustle of the busy city or away from the hospital rooms. Only by actually experiencing this very different setting enables you to understand perhaps a bit better the situation older adults and people with dementia are in. Dementia is heavily stigmatized, if it's known, and seeing a doctor is not free like it is in the NHS. People have to pay every time they want to see a doctor, whilst many symptoms of dementia can often be mistaken for normal aging or wider mental health problems. And even if someone receives a diagnosis, how to receive any follow-on care? Besides more meetings, including at the Institute of Population Health, we went around certain parts of the city and saw locals sell food, spices and flowers on daily markets. In the morning, I went for a run in Cubban Park before traffic was allowed in, and surprisingly, I saw plenty of older adults going for a stroll, which was really lovely to see. Overall, the visit to the NIMHANS and IPH in Bangalore, witnessing the culture and care settings and meeting academics and clinicians in person was of much more meaning than any Zoom meeting could be. Right now, we're waiting the outcome of a funding application and are applying for another one focusing on a separate issue in the field of inequalities. If you have the possibility to travel and meet in person, I would strongly encourage you to take up that opportunity. Because research is all about learning new things in new environments, right?
Thank you for listening. Join the Dementia Research bloggers and share your own views.